Exercise 2B, bleeding control with a tourniquet. If the previous steps are unsuccessful or bleeding is severe, a bleed on a limb can be controlled by tying a tourniquet. Again, this skill is only for severe bleeding on a limb, not the torso or pelvis. Once a tourniquet has been placed, it should not be removed outside of a hospital or treatment facility. If the bleeding starts up again, a second tourniquet can be applied closer to where the limb attaches to the body. Now pictured here is a commercial tourniquet, but commercial tourniquets are not always available, so we will show you how to improvise the tourniquet. I will now detail the steps of an improvised tourniquet. In the next slide, you will see a video demonstration. Step 1. Wrap a triangular bandage around the limb several inches away from the bleeding site toward the torso. Step 2. Secure the bandage on the top of the limb with a knot. Step 3. Place a sturdy stick or similar device parallel to the limb and tie a knot over it. Number 4. Twist the stick clockwise until bleeding stops. Remember, if you're going to practice on yourself or on someone else, just turn it once and say, "I have turned it until bleeding stops." This way you avoid injuring somebody during practice. Step 5. Wrap the ends of the bandage around the stick. And step 6. Tie the bandage ends on the opposite side of the limb from where the injury is. When the body does not have enough oxygen, cells cannot do their jobs. Eventually, cells will die from oxygen deprivation, and the person will not survive. Immediate transport to a medical facility is extremely important. Shock is caused by a variety of conditions, including severe bleeding, heart failure, and spinal injury. If you suspect shock, the priority is to keep the person warm and prevent movement. If they don't seem to have any neck, back, or leg injuries, you can also prop their legs to help improve blood flow to the heart. Let's move on to another topic. A disaster may expose people to extremely hot or cold temperatures, and the body has a difficult time dealing with extreme temperature changes. On a related note, keep in mind that some PPE makes rescuers sweat more frequently, resulting in dehydration and heat exhaustion. Be sure to drink water frequently and rest whenever you feel overheated. The first step is to identify if the person has suffered from exposure to extreme heat or extreme cold, because heat emergencies and cold emergencies have different methods of care and different complications, so drawing a distinction will be very helpful in determining which care you provide. Now, identifying the exposure is not always straightforward. For example, on a really cold day, a person may still suffer from heat exposure if they are in a poorly ventilated area and the heat is cranked to the max. Similarly, on a really hot day, a chef at a restaurant may suffer cold exposure because he got stuck in the walk-in freezer. Taking a moment to establish the cause will help you determine the right care. If the person has been exposed to extreme heat, they may be suffering from something known as heat exhaustion. High heat or exertion causes the body to lose water and electrolytes, until the person is too exhausted to function properly. They will start losing the ability to talk or move their body. Now, to avoid a severe condition known as heat stroke, they need to be given an opportunity to cool off and restore electrolytes. So we want to move the person to a cooler area, we want to elevate their legs, we want to remove excess clothing, fan them. If they're conscious and able to swallow, give them something to drink, room temperature water, a sports drink. No alcohol though, because that actually increases dehydration. When the body temperature rises too high, the body becomes overwhelmed and cannot function at all. This is known as heat stroke. Heat stroke can rapidly lead to coma and death, so care must be quick and aggressive. Because they have reached a crisis level, we must be aggressive in cooling them off. So after moving them to a cool environment, remove their outer clothing, place towel-wrapped ice packs in the groin, neck, and armpits for rapid absorption. Cover them with wet towels and fan them aggressively. In a related note, remember that roadways and vehicles retain heat. Any unconscious person in a roadway or vehicle should be moved out of these areas as quickly as possible to avoid developing a heat-related emergency. When the human body is exposed to extremely cold temperatures, the body will attempt to shiver in an effort to maintain body heat. Eventually, the body will become too cold to shiver, and shivering will stop. Once this happens, the body will begin to shut down. You should suspect cold exposure if a person with cold skin is breathing slowly or acting confused. When caring for a person with cold exposure, getting them into a warm area, removing their wet or frozen clothing, and wrapping them in blankets is the priority. However, if this is not feasible, do not remove their clothing in the cold. Wrap them in blankets over their wet clothing until you can move them to a warmer area. If the person is conscious and you've moved them to a warm area, consider applying towel-wrapped heat packs to the groin, neck, and armpits for rapid absorption. If the person is conscious and able to swallow, help them drink warm liquids to warm them up. Do not let them drink alcohol or caffeine, and do not let them use nicotine. All of these will have a negative effect. When you're warming them, you can use an electric blanket if you have one, but don't warm them too fast. Avoid heat lamps and hot baths. Frostbite is freezing of the tissue, and if it is not corrected, the tissue can die because there is no blood flow. Frostbite usually occurs on underprotected skin like the nose, ears, or fingers. You should suspect frostbite if exposed skin looks red or pale and is cold to the touch. Move the patient to a warmer area. Remove any wet clothing or jewelry from around the frostbitten area. Remember, as the tissue melts, it will swell, so having any jewelry there can cause serious injury. Cover the area with sterile dressings and blankets. And most importantly, keep the patient from moving the frostbitten area or putting any weight on it, because the frozen tissue can break. If you know that the person will not get to a hospital or treatment facility for a half hour or more, we don't want to leave a frostbitten area without blood for so long. So we must rewarm the limb. You do this by immersing the area in warm water and leaving it there until it is pink. Be careful though. Do not allow the defrosted part to refreeze after it's been warmed, because continued freezing and defrosting will damage the blood vessels beyond repair. Let us turn to another topic, caring for unconscious patients. Unconscious patients cannot protect their trachea or windpipe, and if they vomit or bleed in their mouth, they may inhale it into their lungs and choke. You should carefully turn them on their sides, as pictured here, so any vomit or blood can flow out of their mouth onto the floor instead of being inhaled into their lungs. If a person is having a seizure or convulsion, the primary consideration is to protect them from injury during the seizure. Remove any hard objects from around them, place their head on a pillow or a bundle of clothing, and then just wait the seizure out. Once they finish convulsing, they'll likely be confused and embarrassed. Help them sit up so they can catch their breath and get back to normal. Conscious patients who seem to be working hard to breathe should be seated upright. If possible, they can be positioned to lean forward and support themselves on their hands, which is known as the tripod position. Notice in the picture that the person is leaning forward. This position opens the airway passages and makes breathing deeply much easier. Those are the topics for today. We discussed how to avoid injury or illness from hazards during disaster response, the role of disaster volunteers in providing first aid, how to determine what type of first aid a disaster victim requires, how to control bleeding and use limb tourniquets, the identification and care of heat and cold emergencies, and proper positioning for unconscious patients, patients who are convulsing, and patients with trouble breathing. When you finish this training, you will still remember what we discussed. However, studies show that knowledge becomes rusty without frequent review. So please refer back to this training anytime you need a refresher. You may also be interested in some of our other trainings, particularly CPR, emotional resiliency, and pandemic and Ebola safety. Check them out on our disastervolunteerismacademy.org. Additionally, you may want to take a full certification class in first aid. Contact a provider in your community to find a training course. Thank you for joining us today. We honor your commitment to disaster volunteering. Please check out our website, consider becoming a ready responder, or give us a call if you're interested in other training opportunities.